I'm doing my presentation on Ebola and the Ebola vaccine. So, Ebola virus disease is a very rare but often fatal acute illness in humans. It's transmitted to humans through contact with blood, bodily fluids, or secretions from wild animals such as fruit bats, chimpanzees, monkeys, and pigs. Fruit bats are the natural Ebola virus hosts, kind of similarly to COVID-19. Bred from human due to contact with blood, bodily fluids, or objects that have been contaminated with these bodily fluids. It can be passed by someone who is sick with Ebola or by someone who has died from the disease. So, there have been many outbreaks of Ebola, but it first appeared in 1976, one case in South Sudan and one case in the Democratic Republic of the Congo. It usually affects mainly Western Africa. We most commonly know Ebola from the outbreak in 2014 to 2016, which is the biggest outbreak of Ebola in history. So it started in West Africa and spread across 6 Western African countries, as you see here. And it even infected Europe and a little bit of America. So there's different strains of Ebola. The Zaire strain, which is the strain that caused the outbreak in 2014 to 2016. The Sudan strain, Typhorus, and then the Bundibucayo. So it cannot be spread until symptoms are developed, unlike COVID-19 that spreads before we even know we've been infected. So beginning symptoms include flu-like symptoms such as fever, fatigue, muscle pain, headache, sore throat. Many symptoms are similar to pregnancy, so pregnant women usually need to be tested and careful. So within days, clotting forms, vomiting begins, rashes, and it can cause impairment to the kidney and liver function, and uncontrolled bleeding can happen. As the disease goes on, there's more bleeding from mucosal sites, abnormal clotting, and such. It gets worse. It's hard to kind of detect the mortality rate. It was hard for me to find an exact number because it ranges, but I found about 67%. Most people who come in contact with Ebola, so 50% of people who come in contact usually die, shown in this graph here. So Ebola targets and infects monocytes, macrophages, and dendritic cells. So this causes a release of cytokines that lead to the production of these fever-like symptoms. So in 1995, scientists went to the Democratic Republic of the Congo, where there was many Ebola outbreaks, and performed a blood transfusion from an Ebola survivor. So they took his blood and transfused it into 8 patients with acute Ebola, and 7 survived. So they found that in the serum of the fatal cases, there was pro-inflammatory cytokine levels, such as interferon and IL-2, IL-10. They found early activation of T cells correlated with the increase of deaths, possibly because it was unaccompanied by the effector activity of cytotoxic T cells. In the surviving cases, they found elevation of IgM and IgG levels. IgG was detected in all survivors after onset of symptoms, proving that adaptive immune responses could possibly control the infection. So it shows that adaptive immunity against Ebola virus is possible. Using these blood transfusions, they sent some of them to the NIH, where they helped create the monoclonal antibody MAB-114, Ebanga. So this was a drug used to treat children and adults who were already infected from the Zaire Ebola virus. So it's a dose of injection is taken. Although this caused the risk of death to be lowered, a third of patients were still dying even when this was injected. So out of 174 patients with Ebola that took this treatment, 61 patients still died. So it helped, but a vaccine is still necessary. After the outbreak in 2014, a vaccine had to be discovered. At this time, this was the quickest vaccine to be discovered, but I'm not sure if this still holds true due to COVID-19. So Merck created the Ebola Zaire vaccine. It's a replication-competent, live attenuated recombinant vaccine, meaning it's treated to abolish pathogenicity, stimulates the production of neutralizing antibodies that protects vaccinated individuals from infections, and it mimics natural infection, resulting in strong immune response. So it showed to be over 90% effective. So I know a lot of people think when you take a vaccine you can get sick, but it's not possible to become infected with Ebola virus from the vaccine because the vaccine only contains one gene from the virus as opposed to the whole virus. And now, because of this vaccine, there's a cure and a preventable care against the Zaire Ebola virus. So as of today, like 2 weeks ago, they found the Sudan strain in Uganda. So as of October 19th, 2022, there have been 64 confirmed cases, including 25 deaths in Uganda. There are no cases in the US yet, but it's important to prevent it and stop it from spreading any further than it already has. So currently scientists are racing to discover a vaccine for the strain as it spreads rapidly. So over here on the map it shows the cases and how many people have already died in that area. So, like I mentioned, Merck discovered the vaccine for the Zaire strain. So back in 2015, he quietly made a vaccine targeting the Sudan Ebola virus after he created that vaccine against Zaire. So the company had froze this vaccine in bulk. They never tested it on people, they just tested it on monkeys, and they found that the monkeys that were injected with this vaccine were protected from the Sudan Ebola virus. So I actually found an article where he recently, like I think 2 days ago, sent these frozen vaccines to be studied and researched in hopes that they can find a vaccine for the Sudan strain. Given the outcome of Merck's Zaire Ebola vaccine, scientists and people have high hopes that the Sudan Ebola shots will be safe and effective as well. And that's it. Thank you.